I'll be the presenting author regarding the opioid epidemic and what we've seen with respect to myocardic aneurysm strokes and bacterial endocarditis in patients who are IV drug abusers here in Central Ohio. Because it speaks to two things. One, that it marries the epidemic, the opioid epidemic, as we are seeing it continue to evolve, especially in the heart of the epidemic in Ohio, and see the effects on healthcare systems that take care of this patient population. And we are developing insights in that IV drug abuse is a multi-organ, multi-system disease that is having a profound impact on the heart, on the brain, on kidneys, as well as just the idea of overall infection on the body. And we are bringing this to light so that we can start to take very real steps in addressing the opioid epidemic in a substantial way. And the general public, I hope that it brings awareness so that they can understand exactly how much of an impact IV drug abuse is causing to a medical system. But what I hope it does, even more for the general public, that those who are involved in developing programs or directing resources to tackling the opioid epidemic can understand that this is not just a social problem. This is not just a problem of addiction, but this is a very real medical and surgical public health disease that is impacting entire hospital systems. And I imagine that as this type of research continues, not only at our institution, but at institutions across the country, we will be able to get real numbers in terms of patients and the effect financially on these systems, as well as medical and surgical resources that are being used to take care of this patient population, so we understand the overall impact of this epidemic. International Stroke Conference is important because it brings to light the most topical research that is being done around the world in both hemorrhagic and ischemic stroke. The American Stroke Association is essential to disseminate scientific, clinical, epidemiological, and social awareness around all things stroke. What most people forget is that stroke is the first leading cause of combined morbidity and mortality in the world today. And while it ranks fifth leading cause of mortality in the United States, it is the second leading cause of overall mortality around the world. Stroke is not just a disease, it's a public health problem, and programs like the ISC and institutions like the American Stroke Association are essential to get the word out so that people not only know how common and how debilitating stroke is, but can continue to develop ongoing programs so that not only are we educated about stroke, but we are educated on how to prevent stroke, how to treat stroke acutely as a community, and how to embark on secondary prevention strategies so we can actually reverse the current progress as how stroke is affecting our fellow citizens.